With the widespread development of coronary intervention therapy, it has become particularly important to evaluate the relationship between the degree of coronary stenosis and myocardial ischemia and to guide intervention therapy more rationally. Currently, the Fractional Flow Reserve (FFR) is the gold standard for evaluating myocardial ischemia and has significant significance in guiding intervention therapy for critical lesions, multiple lesions, and other complex lesions. The famed series of studies explored the guiding significance of FFR and traditional angiography for PCI treatment. The results of the study confirmed that FFR-guided PCI treatment can significantly reduce the incidence of major adverse cardiac events (MACE) compared with traditional angiography-guided PCI. The expert consensus indicates that the current recommendation is to use 0.8 as the reference standard for evaluating myocardial ischemia with FFR, and that lesions with FFR less than or equal to 0.8 should undergo revascularization, while lesions with FFR greater than 0.8 should be treated with medication. Virtual flow ratio is a new technology developed by Vivolight Medical based on OCT image simulation to calculate the fractional flow reserve like FFR. VFR also uses 0.8 as a reference standard to evaluate myocardial ischemia and reflects the degree of myocardial perfusion/ischemia in patients in current clinical practice. The VFR algorithm is a result of combining published literature findings from abroad with the independent innovative design of Vivolight Medical. It is a calculation of virtual flow ratio based on OCT images, achieved by building a pressure loss model within the blood vessel using fluid dynamics principles. VFR's unique innovation is reflected in the algorithm's integration of intraoperative arterial pressure parameters, which further improves diagnostic accuracy. After selecting the virtual flow ratio in the toolbar on the right side of the pullback interface, the patient's systolic and diastolic arterial pressures can be entered. If pressure values need to be modified, they can be re-entered in the analysis interface after pulling back. Clinical research comparing VFR with FFR suggests that VFR results with input arterial pressure parameters have improved diagnostic accuracy by 22.6% compared to VFR results without input. To access the VFR function in the OCT analysis interface, click on the VFR indicator in the right-hand view toolbar to bring up the VFR long axis view. Click on the unlock icon next to the VFR indicator to enter or modify the patient's systolic and diastolic arterial pressures in the pop-up window. After entering the pressure parameters, the system will recalculate the VFR result. The red to blue gradient on the VFR long axis indicator represents the change in VFR values from small, red, to large, blue. By dragging the yellow-blue control line on the long axis view, the VFR value corresponding to that frame can be displayed. The VFR long axis view can visually reflect a difference in VFR values along the entire vessel segment. During surgery, it is recommended that the operator first identify the location with the maximum difference in VFR values and prioritize treatment based on the lesion condition at that location. The first affiliated hospital of Zhejiang University and Vivolight Medical Technology have collaborated to complete a single-center, prospective, randomized controlled study to verify the diagnostic accuracy of the VFR algorithm. The study selected subjects who required FFR examination and randomly used FFR pressure wires and OCT imaging catheters to examine the same coronary artery and lesion location for each subject. Using FFR as the authoritative standard, the diagnostic accuracy of VFR was verified. The latest research results suggest that VFR and FFR have significant correlation and consistency, and the diagnostic accuracy reaches 98.1%. The VFR algorithm has the characteristics of automatic, efficient, and real-time diagnosis. This study confirms the accuracy of the VFR algorithm and provides important evidence for clinical application. Currently, the VFR function has been applied to Vivolight Medical Technology's global first multimodal OCT device, Coronaris P80, enabling the evaluation of coronary functional study with a single OCT pullback scan. During the examination, there is no need to use vasodilators, which avoids the occurrence of related complications caused by drugs, and there is no additional consumption of consumables or increase in surgery time. The successful fusion of coronary functional study and intracavity imaging techniques enables surgeons to evaluate the condition of lesions through multimodal means, thereby improving patient prognosis.